Welcome to this introduction to the new rcgp prescribing assessment. So first off, I just want to address the reason for introducing this new assessment. So currently, prescribing is quite a large omission from the assessment process for the rcgp. We're not really assessing it in any form, and obviously prescribing is a massive area that we really should be looking at. There's over 1 billion prescriptions issued each year, so it is something that we felt we needed to be looking at. We developed this assessment in collaboration with Nottingham University based on their research, which was called the Practice and also a revisit studies, both of which have been looking at prescribing rates for GPs over the last few years. Now, this assessment doesn't have a particular error rate that you must achieve. What we're actually looking at is how you respond to the errors that you make, and you think about how you can develop as a consequence. What we don't want this assessment to be is a review of how you managed the cases clinically, and we also don't want it to be about prescribing with budget in mind. So whilst this is important, it shouldn't be the primary goal of the assessment. Now, this assessment should be completed in ST3. So if you're starting ST3 in August full time, then we would expect you to complete this assessment by the end of the year. We would highly recommend that you do it in the first 6 months of the year, starting in December, because we need to make sure that you've got enough prescriptions before you start the assessment. If you fall outside of this, you're either less than full time or you don't start in August, then please review our frequently asked questions to see if you should do this and when you should do it. I'd also note that if you do the prescribing assessment, this counts for 2 CBDs, so you can do 2 less CBDs during the year. Now, the process of completing this assessment has been simplified as much as possible, but obviously does require a lot of data, as there are 60 patients' prescriptions that you need to review. And we have, where possible, linked in with the various practice systems to automate some of the searching as much as possible, but we still have some work to do with System 1 to allow this functionality to work. If you're using Vision or EMIS, then we already have an automated search, and there's separate instructions and a video on how you would do this on our website. So as previously mentioned, this assessment looks at 60 of your most recent prescriptions, which is why we recommend you have to have been in practice a few months before you start it. Now, there's a few ways that you'd gather this data. Obviously, the first way is to manually look through your patient notes, look for the last 60 prescriptions and input the data into the Excel spreadsheet. As I said, if you're using some of the practice management systems such as EMIS or Vision, you'll be able to automate this process. And again, look at the instructions on our website to learn how to do this. Once you've collected all of the 60 prescription data in your Excel spreadsheet, you should then spend a reasonable amount of time looking through each of the prescriptions, each of the cases, by going into the patient's notes, using the BNF, using the guidelines that you have locally and nationally, to see if there are any minor errors you've made or even significant errors that you've made. There is guidance on the types of different errors that you could identify, which is again separate to this. We would expect a reasonable amount of errors, certainly for a trainee. We know that from the practice and the revisit study that approximately 1 in 20 prescriptions which are completed by qualified GPs has an error, so it's not unreasonable to think that there will be a reasonable number of errors identified. And the whole point of this assessment is to be able to identify if there is a pattern or anything that you can improve going forwards. Once you've spent time, which we think is probably about equal to 1 session, analysing these prescriptions, we then want you to send this to your trainer, or if you have one, a clinical pharmacist at the practice, who will then review 20 of the prescriptions that you have completed to check for concordance. Now, hopefully there's a reasonable concordance, they'll pick up the same errors as you, but if there is an unreasonable amount of concordance, then they will ask you to repeat the process. Once your supervisor has completed this stage, you should complete the prescribing project reflection form and attach this along with the anonymised Excel spreadsheet to a learning log. You should also be considering any PDPs that you should be making as a consequence of this assessment. We would then expect you to meet with your trainer to talk through this assessment during a tutorial. Think about any objectives that come out as a consequence, any further learning that needs to be identified. And at the end of this, we would want the trainer and educational supervisor to complete the assessment tool form. This form, which is completed by your educational supervisor, also has conclusions as to whether your trainer feels you are prescribing in a safe manner. Once they have completed this, they should then give this to you to attach to the learning log that you've already created. At your next RCP, your panel will review your assessment to check that your educational supervisor believes that you're prescribing safely. So this is now the end of the introductory video. Obviously you may have further questions, and obviously I want you to read the guidance which is available on the workplace-based assessment part of the rcgp website. There's also some other videos on how you might do the search using EMIS and Vision, and hopefully we'll soon be adding System 1. If you do have any further questions, obviously review our frequently asked questions. Don't forget, this assessment is used to look at how you reflect on errors that you make, not looking for a specific pass rate.